Hi, I'm going to talk about week 5 tutorials and just go over what we did this week and also summarise exactly what you might need to know for assignments 2 and 3. So this week we started as usual completing the quiz individually and then talking about it as a team. So make sure you actually have gone over this quiz yourself before you do week 5's assessment quiz. Discuss it with friends in relation to questions that you might be struggling with to get an overall understanding of week 5. Now week 5 is a summary of all the weeks, so it's got both quantitative and qualitative and mixed methods and why we do research. So when we looked this week, this was specifically focused on mixed method, which is a combination of quantitative and qualitative. We talked about why you might do the two different types of methods and in what order. The main thing to consider is that each method informs and aligns with the other, and it is done in a way to best answer the research question. So you might have sequential where you did quantitative and then qualitative, or qualitative and then quantitative. Or you might have convergent, where you're aligning them both at the same time. And then they're coming together to give you an answer. We discussed why you might do qualitative first, and then followed by a survey, quantitative. The students talked about different aspects. It may be that you don't know anything about your research idea, and so you want to ask questions first, qualitatively in interviews, and then understand what is the main points, and then use surveys, which could be validated or non-validated surveys to answer that question. Or you might be doing the surveys first, using validated ones which have been used before and give you a specific answer to the question that you're asking. And then using interviews, which may be semi-structured or open-ended, to give you the context, the understanding, the experience in relation to the survey questions that you asked, which may have asked about stress levels or support needs. And so this then enables that mixed method approach. We also looked and discussed how the research terminology is very different. It's another language. And so we talked about data saturation, which relates to interviews. When one has done enough interviews and the information from the person that you're talking to is similar and giving you the same answer, that's called data saturation. We talked about the reflexivity of the researcher, where it's important that you as a researcher identify who you are, your role, your stance, because this makes sure that you are uncovering any risk of bias in relation to answering the research question. We also talked about reliability in the measurements, and this was from last week where we looked at inter, intra, and test, retest. We talked about the importance of that and that you as early career clinicians are often already doing that. If you do a blood pressure and you're not sure, you then do inter, rate of reliability, you do it yourself. If you're still unsure, then you get a friend, and then you go do inter-related reliability. If you then tested it again in about 10 minutes, that's test, retest. We also talked about different data collection methods and how these need to align with the overall design. So whether that's quantitative, qualitative, or mixed method. We talked about frameworks and that sort of when you're looking at research, there's rules that must be followed. And so as you're reading the article, you need to look for those rules. We talked about the measurements and the range and how different analysis is done. We really looked at sort of the different parts to the published article. We talked about the abstract being the summary of the overall article. It should have all the parts that they did presented in a short summary. Often this is followed by the significance and the recommendations, a short part of what this research highlights. And so that's often included there. The background is the literature review. This should highlight the significance. It may also include operational and conceptual definitions. And it leads in often finishing with a hypothesis if it is quantitative, or a research question. And then this leads to the method. This is the what did they do. So this is the actual information about the frameworks they use, the design, the sample, the setting, the measurements, the analysis, and the ethics. Remembering that this is research should be repeatable. And so if someone is going to repeat something, they need to know what was done. And so research follows frameworks so that we can understand what the researchers and that group did, and we should be able to follow that and repeat it to get similar answers or another answer from another context or setting. This enables us to put research together and to work out and generalize it and maybe translate it to practice. The result is what the researcher found. This should make sense to you as a clinician. So when you're critiquing the articles in A2 and A3, think about, does the results make sense? Is the table easy to read or difficult? When you're looking at critiquing articles, this is the parts that you as a clinician should be able to understand to make sense of. The discussion is the researcher really summarizing it up, linking the current research to his research. So what does this mean? What does the so what is the discussion? So we can look at this in relation to our own clinical practice. This section also has the recommendations and limitations. Research frameworks can be theoretical or conceptual. They need to align with the different methodologies, quantitative, qualitative, or mixed method. And so you might have a theoretical framework such as the Lazarus, stress and coping, or family systems theory. These are theoretical frameworks which give us an idea of how to look at the problem. It might be a conceptual framework, like the conceptual framework of self-efficacy, which is what is in the articles for this week. And so we need to be able to find this as we're reading the article. Research problems. So in the tutorials that we talked about sort of what could be research problems. So think of a research problem that is in your clinical area or related to, what you might be interested in. How could you answer this quantitatively, qualitatively, and what might influence the method you chose? We also discussed how you critically review evidence, and it's about sort of looking for that evidence base. We can look at research, the strengths, the quality, the framework, how easy it is for you as a clinician to read, how well they've presented their results, and does it make sense, and how this relates to your clinical practice. So as you're looking at the articles for A2, think about, can you understand them? Does it make sense? Are the parts in the right areas within the article? That's the strength of research. Assessments. We're getting to the end of our teaching at week 5, and so there will be no more face-to-face teaching. We do, however, have 2 collaborate sessions for you to answer questions, ask questions, and the team site. We will also do 2 mini recordings specifically about assessment 2 and 3. But the main thing is to think about starting and looking at them now. Make a plan for study across all the courses. Review and make headings to go with the assessment criteria. This helps you to start thinking about what is needed and the word count, what you need to look for and how long it's going to take you to do it. Discuss your answers with your friends. It is okay to have that general discussion of, what article they've chosen and why, also how they might be setting it out, what sort of points that they're thinking of. This is that general learning, and it helps you to learn in a team. Ask questions on the team site. Don't be afraid to sort of say, well, I'm struggling with this, because if it's you struggling, I'm sure there's other students as well. So what did we do in the workshops? We really looked at we reviewed published research in a systematic way to understand the population, problem, interest, intervention and outcomes. Why? Because if we're teaching you to be clinicians using evidence-based research, then you need to know how to find good evidence-based research, how to critically review it, and understand what's important to translate from that research to your practice setting. So in research, we looked at how to look at those points, which is why we use the framework. In A3, we're asking you to use that framework to really pull apart the article that we've presented for you to look at. So that's why we're looking at research in nursing, to help you make sure that you provide evidence-based practice for your future patients. So in summary, just remember to keep looking through those modules. If there's questions that you've got, they'll be in the modules or in the textbook. Use the textbook to help support and provide evidence and references for your A2 and A3. Look at the research articles and look in their methods section and their recommendation sections for their references and how you might then build from those references to justify your own ideas. Complete week 5 quiz before 8:30 a.m. on Monday so it doesn't close before you've finished. Stay in contact with us over the trimester. So if you're having problems, you might need to talk to the convener, put in an application for extensions or special considerations after the submission of that assessment item. Encourage and engage with each other on the Teams site. Thank you.